What ideas do you have to reduce the cost of delivery of Medicare for seniors versus just shifting the cost of Medicare to the patient?
Well, I think one of the things you have to understand is right now, with the plan that we're talking about, if you're 55 years above, there's no change. But what we have to look at is right now, we're already starting to see doctors refuse Medicare patients. We're already seeing doctors who are continuing to practice defensive medicine. We're seeing a rise in insurance rates, which was one of the things that we said would not happen. You know, one of the most important things we have to do, I mean, we have to introduce a competition out there with insurance companies because we don't have that. Right now, the insurance companies have the upper hand on you because you cannot compete outside of this state. The other thing we have to look at is when you understand the difference between traditional or normal Medicare as opposed to the Medicare Advantage program. One of the reasons why the Medicare Advantage program is going up is because the reimbursements for people on the normal Medicare is going down. And so Medicare Advantage patients are the ones now that are being asked to foot that balance or that difference. So the thing is this, you know, we have to look at, if we are going to sustain Medicare for future generations, like I said myself, what are the means by which we can introduce a defined contribution premium support plan, whatever you want to call it, because the fee-for-service that we have right now is destroying Medicare. I've had many people come and say, most times when I go and I use the Medicare, I don't even know what the bill is that Medicare puts up. And that's where you get a lot of fraud, you get a lot of waste, you get a lot of abuse. We have got to do something about this program, or else the clock is ticking. 2024, and it goes away. So the thing is, we want to make sure that our current seniors maintain the same programs that we have, but I would like to see reforms as far as the insurance companies so that we can have the clear and open, clear thing that everyone has to understand is that there was a group of individuals that voted last year to cut Medicare. They voted to cut $500 billion out of Medicare. I have not voted to cut Medicare. The thing that I voted to try to do is sustain Medicare, reform Medicare so it can be here for future generations. So I want to see this program continue on. But if I came here and admitted to you that doing nothing is a solution, then I'd be lying to you. We have got to do something about this program, or else it won't be there. It won't even be there for some of the seniors that are, you know, about to enter this program that are, you know, 55, 56, like I said, 13 years. You want to keep your kid on your program after 26, not a problem. If you want to make sure that people with pre-existing conditions are covered, absolutely. If you want to make sure that we are closing that donut hole, I'm all for it. But those things that I just talked about right there, I could probably get with someone, we could create legislation about 10 pages. It's the other 2,690 pages of that law that allows them these last job reports. 50% of the jobs that were created in the private sector were created by McDonald's. And it was McDonald's who was one of the first corporations that went and asked for a waiver from the Patient Protection and Obamacare Act. Now, if you want to see 159 new government agencies and bureaucracies, if you want to see 11 new taxes, if you want to see 16,000 new IRS agents, you got it. But I think there's a different way that we can reform healthcare in the United States of America, and that's what I'm